This talk is on reflective thinking, and I'm Professor Meguid Nahas. So, what is reflective thinking, and why do we give it so much importance in your talk 2014? Well, reflective thinking and reflective medical practice should really be at the heart of your day-to-day clinical activities. It's a way to think about what you do, to learn from what you do, and to ultimately improve the outcome of your clinical services and practice and the provision of health care to your patients. So reflective thinking is generic, not just confined to renal transplantation or any aspects of medicine. It's a way of thinking that you may be familiar with, and if you're not familiar with, it's a way of thinking we want to familiarize you with, and we want you to acquire a second nature, and for it to become, throughout the next 6 months, a part of all your clinical thinking and practice. So one way to remember will be, what is reflective thinking? Well, let's find an easy way to remember it. And on, in, on, and oh. What is on? What is in? What is on again? And what is and what is oh? It's a bit like the 5 whats, to which we'll come back. So, ways to remember. So, on is to reflect on what you are about to do and give due consideration. Let's say if you want to do a renal biopsy, you think long and hard. Is it justified? Ask yourself the 5 whats. Why am I doing it for? What's the evidence that it will be useful? Will it be useful to that particular patient? Can I offer him something? What is the risk? And what is the cost associated with the investigation that I'm embarking on, or with the treatment I'm embarking on, and so on and so forth. So you reflect even before you start a medical act. And then whilst you're doing it, am I doing it to the best of my ability? Are there different ways of doing it? What's the evidence that this is the best way of doing it? What is the risk with the way I'm doing this? Investigation, treatment, procedure, operation, and so on. And then once it's all been done, and you've searched the literature, and you've learned from your experience, you go back and think about what you had done. And you document all this in a diary, in your little pocket diary, or on the Ola, or in your course portfolio, or in the Ola forum section of talk. And is I have learned, I've realized that what I used to do may not have been the best way, but having read, having learned during the procedure or during the decision making, now I know that things can be done better, or I know more, or I have enhanced my continuing nephrology education. And I will be able next time round, when I'm encountering a similar case, a similar problem, a similar challenge, or a similar investigation, to improve my practice. Ultimately, with the patient well-being utmost in your mind. So you think before, you keep thinking during the investigation, treatment, operation, whatever medical activity you undertake, learning, and you reflect and you summarize and you learn from the whole process. So reflective medical practice is a way of translating medical practice through reflection into education and a learning exercise. Okay? And you can go on the internet, and we'll ask you at the end some tasks, but you'll see that there are many theories, many models of reflective thinking and reflective medical practice. But what I'm giving you is the synopsis and the principle and the simple way of applying. And I want you to link all your practices with the 5 whats. And there is a talk on the 5 whats. So if you haven't seen the talk on the 5 whats, what are the 5 whats? They are what for, what am I treating for, what am I doing a test for, what am I requesting an x-ray for, what am I biopsying for, what am I using this drug rather than that drug for. What is the evidence? We want you to be familiar with evidence-based medicine. Not that you've heard somebody telling you that that's a good treatment. Not that your boss has told you that's a good treatment. He may be biased, but at the end of the day, it's you who are prescribing a treatment. It's you who are undertaking an investigation. So ultimately, you are responsible of your medical action, and therefore you need to know the evidence and the strengths of evidence behind what you do. What's the relevance? Something that may be useful for somebody else. Is it relevant to my patient? If you're planning to embark on immunosuppression, it may be applicable to a 20-year-old. Is it applicable to an 85-year-old with diabetes who's already immunocompromised? No. So you have to put it in context. What are the risks? What are the benefits? And what is the cost benefit? And go back to the 5 whats talk, and you'll see that we're going through these 5 questions that I want you to ask yourself. And sometimes I put a H5, what are the questions? And sometimes I just put what's, it should have 2 T's here, as electricity, question, lights. And then now, for reflective critical thinking, I want you to add a 6th question, which is, having run through the 5, having gone through the actual reflective medical practice, having gone through whatever you decided to do, or not for that matter, 6, what is, what did I learn? Leading to, how will I do it next time round, based on my newly acquired knowledge and information? Leading to, how will I make sure that every time and every day I improve my healthcare delivery to my patients? And the Gibbs reflective thinking cycle is as follows. Describe what's happened, how you've learned, what you went through, the difficult, but also express your feelings. I was disappointed that the patient was not on the right medication or whatever. I was pleased to learn that there is a better way of treating this patient. I was delighted to see that the patient got better when I searched the literature, looked for the evidence, and gave him or her the most appropriate treatment. Evaluate the experience, what I've been through with that issue or that patient or that case. Was it a good experience or a bad experience? Try to put it in the context. What sense can you make of the whole situation? Let's say you biopsy the patient and he was rushed, he was discharged earlier, he was still bleeding, he came back, his hemoglobin was 5 grams per deciliter. You may have a sense that the patient has been mismanaged, and always conclude, what else could have been done? What else could have I done better? And if it happens next time round, how will I handle this situation? And in that Gibbs cycle of reflection, every point, every heading leads to a learning. Every heading reinforces your second nature of becoming a reflective thinker, an independent critical thinker. And this will impact on your decision making, because you have undertaken the evaluation. You have collected the facts. You have analyzed your behavior. You have improved your skills through reflective thinking and ongoing reflective learning and education. You have a plan for next time, you will implement it next time, and you will provide better service. And that's again at the essence of clinical governance, at the essence of audit. Learning through practice, which is the whole point of the talk and the nephrology online courses you're embarking on, but learning through intelligent, reflective, critical practice. Intelligent, not because you know everything, but because you question everything you think you know. Oh, I know that this treatment is better than that. Very often I'll be asking you, whether it's on the online forum, whether it's in your portfolio, whether it's on the Facebook talk group discussion, what is the evidence? Why do you think that you know? And the evidence has to be read, has to be understood, has to be appraised. It's no good saying, oh, the guidelines are telling me to do that. Have you read them? No. Have you evaluated the strengths of the guideline? Because if it's level 2, it's not even a recommendation, it is a suggestion. And if it's level 2C, it's a suggestion based on no evidence. So you have to formulate what is best for your patient. So you have to start by asking yourself questions, asking other questions, getting the answers. And we are here throughout the course, throughout the next 6 months to help you with that. So that you know, you rely on your own information, you rely on your own knowledge based on evidence to treat a patient, because you're responsible of your medical acts. If you hurt a patient, if you kill a patient, it's no good saying, well, the guidelines told me to kill him. It's no good saying, well, my boss or the professor told me to kill him. You will be held responsible, if not legally, personally. And this is where, I think it was Benjamin Franklin who said, it is the first responsibility of every citizen to question. Again, we're coming back to the importance of questioning knowledge, questioning evidence, but he was stressing questioning authority. So if your boss tells you that is the way it is, fine, but go and read and ask and discuss on Ola, talk forum, discuss on Facebook with us. What is the evidence? Because if he misguides you, because he has not gone through a nephrology online course, he's not familiar with reflective practice, he's old school and hasn't read much, basing his information and his practice on obsolete, old, and often wrong, lacking in evidence, facts, then you will be like him, ultimately a bad or poor nephrologist. So do it better. That's what you always want to do. And to do things better, you have to learn. You have to find the evidence. You have to solve and reflect on what you do to improve what you do. And through that cycle, the Gibbs reflective thinking cycle, enhance yourself, enrich yourself, grow as a learner, grow as a thinker, and grow as a nephrologist. And in the process, you will become of educating yourself, of training yourself with the help and the guidance of our faculty and the talk and your colleagues. You will embark on the clinical governance cycle. What's the clinical governance? It's a cycle based on learning from our practice. I wasn't going to say mistake, but documenting our practice, learning from our practice, looking at the outcomes of our practice, the clinical effectiveness, read and research and try to question our clinical effectiveness in an open way. So openness, open and transparent way. As I said, the talk, I said before in the introduction to the talk, We're not here to test you. We're not in a primary school. We're not in a medical school. We're not here to test you, to punish you, to trick you. It has to be open. You have to feel safe. And the talk is a safe environment to say, I don't know. I have no idea. So you open so that people can help you with knowledge, guide you as to where to find the answer, to improve your clinical effectiveness, to improve your risk management, minimize patients' risk, and improve health care delivery through education and training, impacting on clinical activities, leading to transparent clinical governance. So you are accountable, but you covered all the bases, you covered all the points. So you're not accountable on a medical action that you've done out of ignorance, but you're now accountable for a medical action you've done and an outcome out of sound thinking and knowledge. And first and foremost is remember what Hippocrates said, first and foremost, primum non nocere. First and foremost, do no harm, which takes us back to risk management. Minimize the risk, which takes us back to the 5 whats. What is the justification of the procedure if I take and ask myself the 5 whats? Including what is the risk versus benefit of what I'm doing or what I'm about to do or what I've done to my patient. So over the first 4 weeks of your talk, we want you to start familiarizing yourself with reflective thinking, with reflective medical practice. Some of you have already done that through the CKD NOC, so it's easy for them to write it down and submit their essays. But basically, during the first 4 weeks of your talk, we will ask you to write a 500 words essay on reflective medical practice. 500 words means 500 words. So in other words, it's not 400 words, it's not 501 or 600 words, it's around 500 words on reflective medical practice. And again, this gives you the discipline of writing. You know, if we ask you to write 500 words, don't write 20 words. If we ask you to summarize something in 500 words, don't write 6 pages and submit a 3,000 words essay. Then we'll ask you to write 500 words on evidence-based medicine, 500 words on critical thinking and critical appraisal, and 500 words on clinical governance and audit. You may say, well, where can we find all this information? All you need to do is go to Google, put reflective thinking or reflective medical practice, go to Google, put evidence-based medicine, go to Google, put critical thinking, and go to Google, put audit or clinical governance, and you will have hundreds of resources from which to find the information you need. So I'll leave you with that, and we'll work on it during the first 4 weeks of your course. And this will give you the foundation upon which we'll base the whole entire remaining 5 months or the 6 months of the talk: reflective thinking, critical thinking, reflective medical practice. Thank you very much for your attention.